Bipolar disorder, also known as bipolar affective disorder, manic depressive disorder, or manic depression, is a mental illness characterized by episodes of an elevated mood known as mania, usually alternating with episodes of depression. During mania, an individual feels abnormally happy, energetic, or excitable, but often makes poor decisions due to unrealistic ideas or poor regard of consequences. Sadly, these disorders can usually affect up to at least 40% of families. The causes of bipolar disorder likely vary between individuals, and exact mechanism underlying the disorder remains unclear.
Feel like happiness is the truth because I'm happy. Clap along if you know what happiness is to you because I'm happy. Clap along if you.
Those few images were some of the outcomes to the second type of mania, the dysphoric that is really awful, and a euphoric mania that can feel like true happiness. However, mania is not always happiness, necessarily. It's a chemically induced mood swing that only seems joyful, especially when contrasted with unhappiness caused by depression. Here's how you tell the difference. Extreme happiness is attached to an event. It's explainable when someone asks why you're so happy. Mania happiness is not really event oriented. It just makes you happy about everything. The sky makes you happy, the color of grass makes you happy, strangers can even make you happy. Sometimes even the food you may eat. Happiness is just floating everywhere.
Besides pimping, you really ain't got the stomach for that.
We are here today with Mr. Kapler. Thank you for your time, sir. First question would be, what exactly is bipolar?
Bipolar, first of all, it's an illness. It's a mood disorder, and it's something that's really very difficult for people in the medical field to be able to name.
For sure. Where did you gain your knowledge of bipolar disorder?
I functioned as a school psychologist in the public schools of southeastern Minnesota for about 27 years, and because of serving all students, I had to learn about bipolar disorder because it was believed that I was working with some students that were bipolar. Prior to that, I learned about it in college, even before I became a school psychologist, but never in high school like you're doing. I learned about it.
For sure. Where does this disorder come from?
Well, our brains function normally if everything is normal, and in some instances, some of us have problems functioning normally. We become depressed. We don't. It's a mental illness, but we don't know exactly what causes it. It's just not known for sure what causes bipolar. It's not sure what causes depression, a depressive disorder. We're still trying to evaluate that.
Most
Meaning
definitely.
medical in the medical field, they're trying to do that.
For sure. How many people exactly in the U.S. suffer from this disorder?
Well, I saw the figure just recently, and although the book that I obtained this information from is about 12 years old, it would be around this number. And they say that 2.5 million people in the U.S. have bipolar disorder. That's a very small percentage of the total population, but it's a very complicated illness and can cause a lot of problems for more than just the individual that has bipolar.
Right. Is it any growing numbers at all in that area?
No, that I can't tell you. I don't know. I don't think it's growing. I think it's very difficult to decode and determine, whether somebody suffers from bipolar. But we are doing better, meaning the medical field is able to come up with better questions, better knowledge by observing if people have bipolar. And so, therefore, in that regard, yes, more people are now being given that label.
Sure. Can it be tested at all?
You mean a test? Do we have a test that will determine whether you're bipolar or not? No, the
Correct.
answer is absolutely not. We don't have any blood tests. We don't have any any kind of a urinalysis or anything like that. It doesn't work that way. So it's much more complicated to decode and figure out whether you have or anyone has that or who has it.
Understandable. How long does it usually take till the person is aware that they have bipolar?
Usually, the greatest number of people are diagnosed between the ages of 20 and 29. That's the greatest number. But still, we still have a lot of people that are not diagnosed until after age 50, 50 to 59. They just don't have the seriousness in their depressive problems that other have. But we see more and more teenagers being diagnosed with bipolar, or as bipolar, I should say.
Sure. Is it possible to have a high rate of depression and not be bipolar?
Yes, many people suffer from depression. Sometimes it's just a situational depression, but it is depression. And they can suffer from just one or two episodes, so they can have ongoing episodes during their lifetime and not be bipolar.
How effective can the medication be?
Oh, once it's determined that someone is bipolar and they're given a medication, that medication can be very, very effective. That medication can sort of make them function, as an average individual. They just have to take that medication perhaps twice a day and remember to do so. Very effective, the medication is.
Is it easy to cope with once you're aware that you are bipolar?
Well, that's a question that I would have to say that it determines on your, the type of personality you have. If you see yourself once you're diagnosed with bipolar, if you see yourself as, well, now I'm lucky because I'm not going to be this way anymore. I'm not going to feel this way. Once I get the medication, I'm going to be completely, I don't know about completely, but I'm going to be good. I'm going to be good to go.
For sure.
And so I think that gives most people a lot of hope.
Most definitely. Well, you basically answered every single question to the best of your knowledge, and I appreciate your time, Mr. Capital.
Listen, thanks for asking me up here, because I always appreciate learning and watching high school students learn about something new and different.
For sure. Thank you for your time.